Hello, my name is Dr. Paul Scheiwiller. I'm an anesthesiologist here at the Institute of Orthopedic Surgery. I want to talk to you today about a femoral nerve block with a continuous infusion that your surgeon has ordered for your postoperative pain management. Before we get started, I'd like to introduce you to several members of the team. They include, first, an SBA, or a special block assistant. She will be positioning, prepping, and assisting in the procedure. She also will monitor you before, during, and after the block. She will also assist in your comfort. You will also be meeting an anesthesia provider. He or she is an anesthesiologist or a nurse anesthetist. This person is responsible for your anesthesia and will be taking you back to the operating room, getting you off to sleep, monitoring you very carefully during the procedure, waking you up, and taking you to our recovery room. These procedures have been designed with your comfort and safety. The nerves to the knee are located in the upper thigh groin area. This is where the block is performed. This is a very simple procedure, will take less than 15 minutes to complete, and the blocks generally last approximately 2 days. It's important to understand that these blocks will do what we call stepping down. A step down simply means that the block will decrease in intensity after approximately 24 hours. The block is souped up today because this is the day of the most pain. Some of the feeling will return in the leg as well as some of the strength. Be prepared, this is to be expected. You will be provided with pain medications at regular intervals in the hospital. It's very important that you keep up with these medicines, both here at the hospital and if you go home. You will receive specific recommendations at discharge regarding your pain medications. You will be placed in the supine or backup position for this procedure. The SBA will be prepping and draping you. An ultrasound probe will be placed over these nerves. An ultrasound machine allows us to look underneath the skin and see these nerves. This is extremely helpful. Then we take a very small needle, which is roughly the size that a diabetic would inject themselves with, and then we numb up a very small patch of skin about the size of a dime. Then a special block needle is placed through the numb skin and is directed to the proper location. We use the ultrasound machine to guide us during this portion. Your thigh might twitch. We will tell you ahead of time to expect this. Medication is then injected. Before we remove the needle, a small plastic piece of tubing about the size of fishing line, and this line is hollow and has holes in the end of it, is passed through the needle and placed next to the nerves. The needle is withdrawn. The skin is sealed with a special glue. A pump is hooked up to the tubing. It will infuse slowly around the nerves, again for approximately 2 days. Remember, the block is stronger today than the following days. There may be a small button to push if you feel you need more medications. Removing of the block tube. This is generally done at the hospital by our nursing staff. However, it's a very simple procedure. They will start at the end of the connection. They will slowly remove the tape. Generally, a clear, crusty scab will be present at the end as it inserts into your skin. They'll gently pull towards this, pull it backing out the catheter. We'll verify that the tip is intact, and that's it. The area of the block is the area of the orange and purple. The blocked nerves do not go to these to other areas. You may have pain in unblocked areas, which include the back of the knee and many times the sides of the knees. Pain medication will be provided if you have pain in unblocked areas. After the block, you may notice warmth, and your thigh may feel as if it is extremely heavy. This is temporary, lasts about 12 to 24 hours. Your lower extremity will not feel numb. It just feels very strange, and this does not go to your foot. The side effects, again, can last 12 to 24 hours and rarely up to 48. Extreme heaviness and weakness of your thigh. Again, extreme caution is necessary with ambulation. Again, we cannot emphasize you must be very careful with your leg. Again, use extreme caution with ambulation. Anytime you feel you're going to be getting up, make sure you call your nurse and make sure you wait for them. Use assistive devices as prescribed. If you're going home with the block, please make sure you have a clear, safe path between your bed and the bathroom, the bed and the refrigerator, bed and TV, etc. Wear your brace as directed. The benefits of the block extend into the operating room. Generally, your anesthesia will be much less, and pain medications during the operation will not need to be as high. Generally, you wake up quicker with less nausea and vomiting. Generally, are discharged from the hospital or the PACU faster. Generally, significantly less pain postoperatively. Anytime we place a needle in anybody for any reason at all, there is a small amount of risk. This includes damage to surrounding structures, veins, arteries, nerves, muscles, risk of medication reaction, infection, but this is why we use an ultrasound machine, specially designed block needles, injection techniques. We monitor you before, during, and after the procedure. A few housekeeping items. Your guests will be asked to exit. We will bring in our equipment, which includes ultrasound machine and several trays of equipment and materials. You will be hooked up to the monitors, EKG, finger clip, and blood pressure cuff. We understand if you're nervous. It's perfectly normal. We're going to take great care of you. The nurse will generally provide you with a light dose of sedation, which is roughly equal to 2 drinks or 2 Bud Lights. This is given before your procedure through established IVs. If you do go home with this block and you have some questions, please don't hesitate to contact us. The number is on your handout. I will be in very shortly to discuss with you any questions that you may have, and please don't hesitate to ask. That's what I'm here for. Thank you very much. I appreciate your attention.